Thank you. We're also trying to get to the floor. We have 2 items left. First one is AB 1618, and this is our trailer bill on No Place Like Home. This is an item we have had lengthy conversation about, but I do know that there is some additional oversight and accountability that will be found in this trailer bill, and we want to hear a little bit about that.
That's correct, and I'm happy to report that AB 1618 was previously heard by the committee, and we have a number of amendments before you today, some of which is based on the public comment that was taken actually during that hearing. So let me just go over several of the new provisions of this trailer bill. AB 1618 would require that one of the governor's appointees to the Mental Health Services Oversight and Accountability Commission have a background in auditing. It would require the Department of Healthcare Services to post on its website the 3-year program and expenditure plan submitted by counties pursuant to the Mental Health Services Act. It would have the Department of Healthcare Services conduct reviews of performance contracts and also annually post on its website a summary of those performance outcome reports submitted by counties and any county correction plans. It would allow the department to withhold funds from counties who did not submit their annual revenue and expenditure reports by the required deadline. And lastly, it would allow HCD, when awarding grants under the No Place Like Home program, to evaluate applications that demonstrate a past history of implementing programs that use evidence-based practices and that have led to a reduction in chronic homelessness or those at risk of homelessness. With that, happy to answer any questions.
Thank you, Ms. Costa. Senator Nguyen?
Actually, I don't have a question. I just want a comment.
Sure, go right ahead.
I just want to, the comment I have is, I appreciate the bill, and I think it's the right thing to do. One of the things, though, is I know that when we had discussions in the past and some of the public comments, is that the bill itself, I know it is there to address homelessness. Well, one of the things that that were public comments and I share the concern is that this bill only creates a one-size-fits-all approach addressing homelessness and could exclude programs like St. John's program in Sacramento because of the requirements in terms of sober living or not. And so I do hope that as we move forward, we make sure that we allow all different programs to exist, especially those programs that are already currently working. And, you know, I don't want St. John's program to not be able to apply for these grants because of their current program in terms of sober living, and yet they are a very successful program, and a lot of us individually here have gone to the site and has visited the site and have also donated to the site as well. So.
I would note for counties specifically, Senator, some of the public comment that we heard when this was last before the committee were from 2 counties that expressed concern that the programmatic elements didn't take into account counties that actually have demonstrated success in these programs. And so we do have an amendment before you today that would allow HCD to take that into consideration. Specifically for that purpose. I think the public comment was well taken that we didn't want to put counties who have had success in this area be, you know, lose out on this funding source because of their early successes.
So what I'm hearing then, does that mean that programs like St. John's, say in Sacramento, if they decide to mimic their programs that would work for programs like St. John's, they can apply?
Justin Howard, Department of Finance. I'm not necessarily familiar with the St. John's program, but the way that this program works is it's the county that will be applying for the funds in a competitive program or an over-the-counter program, and the county can have a co-sponsor with them who can be a developer. What the purpose of this program is to target permanent supportive housing for the homeless, chronically homeless, or those at risk who also have who have mental health needs. So this is a very targeted population that we're trying to address.
Thank you.
Thank you, Senator Nguyen. If it's any comfort to you, this will not interfere with any of the service programs that are ongoing. This is to create a new pot of money by securitizing the $2 billion coming in from Prop 63 for the very specific purpose, as Mr. Howard said, for permanent supportive housing for those living on the streets who would also otherwise qualify for the services that you're talking about from Prop 63.
I think also, I think it's not so much of that they will be excluded, it's that they can't even apply for the new programs, even though I remember St. John's coming and seeking for advice or input, because their program target more, you have to be sober living in order to stay in their program until, set numbers of days and et cetera. And so the program we have here might exclude them from being able to apply for the new program, the $2 billion. So I just want to bring it back up and make sure that we don't, there are programs that are currently working. I don't want them to exclude them from the new programs to add more to the beds, because I remember, I don't remember numbers, hundreds of individuals that could use the beds and living. And so I just don't want them to be accidentally excluded.
Senator Nguyen, actually, you do raise a good question. Mr. Howard, if you could clarify for us. So my understanding is there will be discretion from county to county as to what requirements they're going to have in place for acceptance into these new units of housing. So if a county has a program that Senator Nguyen's referring to that requires to be a part of the program, you have to be clean and sober, could that requirement be carried into this housing that we're going to provide?
Sure.
That would be an eligibility requirement, I think is what Senator Nguyen is asking.
Yeah, so through the program guidelines that will be established by HCD, the counties are required to provide for a minimum of 20 years services for the individuals who will be housed in these permanent supportive housings. And that could be through those types of programs that are offered by St. John's. Again, I don't know all the specifics about that program, but it could be any type of program that's targeted for these individuals who have mental health needs. And that could be a requirement, and that will be dealt with between the counties when they come forward with their plan for how they plan to
So those determinations
provide the
won't be made
services.
by the state, but by the county as they construct their.
Yeah, that'll likely be one of the criteria considered, is what types of services, where these facilities will be located so that they're close to the services that
imagine
are already funded via Prop 63 funding.
Some of those debates will occur at meetings of county boards of supervisors.
Yeah.
Okay, thank you. Senator Mitchell.
Thank you. I just wanted to remind us all again that federal dollars under HUD, we've, as a nation, have shifted our policy from a punitive one, punishing people who are victims of substance abuse, to a supportive one through the Housing First model. And so HUD dollars cannot be used for facilities who require drug testing in order to stay in the facility. And so I think we should be clear about the national focus of Housing First. Number two, since St. John specifically was brought up today, I am not sure that it meets the permanent supportive housing model as opposed to transitional housing. So this may be an apples and oranges comparison. And thirdly, I would ask, because I've asked St. John's and I've never been given an answer, how many dirty drug tests they get a month. We spent a lot of time in this body talking about this one model, this one facility in Sacramento, albeit a great one. But since we want to continue to reverse the national trend towards Housing First, the question I continue to raise is how many dirty tests and how many women are put out a month? If we really think that that's a barrier to successful transition into a permanent supportive housing environment.
Thank you, Senator Mitchell. I think you make reference to a good body of literature that shows that the punitive model is not getting us to where we need to go to, but that is another conversation. Yes, Senator Monning.
Thank you, Mr. Chair. Just a quick clarification. The definition includes the population at risk of chronic homelessness, and who will make that determination as to who qualifies for being at risk?
Yes, thank you. So that'll also be laid out in the program guidelines, but it is to include like youthful members of the population, those who are coming out of facilities of incarceration. It could be state or a local facility, but it's a pretty broad definition so that we can make sure that we capture the largest population possible who are potentially at risk, as well as addressing the mental health aspects of their conditions.
And again, that's what I seek to clarify. We have some programs in my district where they may not be considered coming out of an institution, but have received some type of support in transitional housing, who would like to be eligible for the permanent housing competition.
Yeah, fair. We intend to be very broad with it as long as there's a nexus to the need to provide the services for their mental health conditions, because there is that restriction and then the fact of the funds that we're securitizing.
Thank you.
Thank you, Senator Monning. So before I call on Senator Stone, just to refocus the conversation, because we do want to get to the floor, what's before us today in this trailer bill are some amendments, and they're all about oversight, accountability, and performance review. For example, requiring that DHCS regularly posts the annual revenue and expenditure reports for each of the counties' 3-year expenditure plan, and requires counties to certify the accuracy of the data they submit to the department, that the department can withhold Prop 63 funds from counties that fail to comply with reporting requirements. So these are all strengthening measures to the original plan that we had already agreed to. Senator Stone.
Thank you. Thank you, Mr. Chairman. There have been some counties that have been very proactive in putting programs in place to reduce homelessness, in particular in the Inland Empire, San Bernardino, and Riverside County. When I was on the Board of Supervisors, we made it a high priority and leveraged state funds and federal funds. And their concern, I think that's one of the reasons why San Bernardino is opposed to this, and I think Riverside County would probably feel the same way, is that there needs to be some recommended factor, if you will, that takes into consideration the success in the time and count, because the time and count of homelessness in San Bernardino and Riverside County is going to be much lower than had they not intervened and fix the problem. And some of that probably involves some general fund costs. And so I think to bring the other counties that have been successful into this program, which I think is very important statewide, has there been any thought of modifying the formula to give some credit, if you will, for counties' success in reducing the time and count homelessness numbers?
In here just for a second. I have a letter from San Bernardino County, which removes their opposition, specifically on your point, Senator.
Oh, good.
They were concerned, as you've described, and so the amendment taken for them in other counties in their situation is that past history of implementing programs that use evidence-based best practices that have led to the reduction of the number of chronic homeless or at risk of chronic homeless individuals within the target population.
Thank you for bringing that to my attention.
Surely.
Those concerns were addressed.
Anyone else? We have a motion by Senator Roth. Is there public comment? If you could line up quickly, please. And if you could keep your comments short, we'd appreciate it because we have to get to the floor.
Good afternoon, Senator and members. I'm Farah McDade Ting on behalf of the California State Association of Counties, as well as the California Behavioral Health Directors Association, in support of this measure. The recent amendments do increase some transparency with MHSA funding at the local level. We are in support of all of the amendments, as well as the amendment that takes into concern the Inland Empire's concerns. I would note that we've worked very hard on this measure. CSAC has, along with the county coalition, with all the Department of Finance, with the HCD, and with the Senate staff on this measure. They worked very hard to make sure that this measure allows all counties to access the funds, even the teeny tiny counties, as well as the larger, somewhat referred to as high-cost counties. This measure includes a $500,000 floor for all counties who apply for a certain pot of money, and it also allows you to refurbish units. You don't have to build from the ground up. In many of your counties, that's nearly impossible. So you can refurbish units or capitalize operating costs. So we think this measure is worthwhile. It allows access for all counties, and we look forward to seeing it pass. Thank you.
So with that said, I would appreciate it that we're not going to review the whole bill. We've already done that.
Very good.
So if you have comments, address them to the amendments that are before us.
David Jones on behalf of the cities of Sacramento and Glendale in support of the bill.
Thank you, Mr. Jones.
Yes, my name is Rose King. I'm co-founder of Right to Treatment and part of a coalition of grassroots organizations. We oppose, and also I'm a co-author of Prop 63. We oppose AB 1618 because it does not target strictly the Prop 63 target population. And it does not take into account, the amendments do not take into account the quality and lack of quality of care provided today. My grandson, for instance, is prescribed heavy-duty psychotropic medications and told to come back in 4.5 months for an appointment. That's the quality of care. Child psychiatrists report in several counties around the state, they have hundreds of children in their caseloads. Our housing first experience was my grandson was housed with a violent ex-felon, twice his age, who also we found out, was a registered sex offender. That's what happened to him. California's neglect goes back 60 years of serious mental illness. I know homelessness is something you want to do something about, but 60 years of neglect of serious mental illness is what Prop 63 was to address. So as to the amendments, if the amendments do nothing to change the fox guarding the hen house situation today, where it's all self-reporting, the questions you need to ask is, does the county plan comply with provisions of Prop 63 law, if you really want accountability? And then, has Prop 63 spending improved quality of care or access to treatment? Now, you know from prison and jail populations that have doubled, people wait months for a clinic appointment or state hospital. Suicide deaths have increased, and emergency rooms are overwhelmed with Medi-Cal insured patients. Those people in emergency rooms are insured by Medi-Cal because they can't get community treatment because there isn't access at clinics. So anyway, we ask you to please consider who you are serving and taking care of funding a mental health system first before you decide to fund another program when you have spent $17 billion on a program that has failed 3 state audits. So I ask you to serve the people intended by the voters.
Thank you, Ms. King, and thank you for all your efforts behind Prop 63. You are legendary.
Kim Lewis with the California Coalition for Youth in support of the bill. Thank you.
Thank you.
Martha Guerrero, representing the Los Angeles County Board of Supervisors in support of the bill and the amendments.
Thank you.
Good morning, Christina Wojciechowicz on behalf of the County of Santa Barbara Board of Supervisors. Unfortunately, we're still unopposed to the bill. The county is still concerned that it will lose its mental health funding if the revenues decline. Thank you.
Thank you.
Hello, I'm Lauren Ritaliata. I'm a family member of a loved one in a full-service partnership who is unhoused, but I oppose this bill. And the one thing, I haven't had time to come to speak to you before, but in your legislative analysis, it says state legislative's intent that the cost to service the debt for the bond shall not impede direct mental health services provided by the counties. Did you receive the letter from Contra Costa County, which clearly states to you that our ability to care for those with a severe mental illness will be impacted by the cost of the bond indebtedness? Everyone keeps saying that it will not affect counties. It will greatly affect counties' ability to care for those with a serious mental illness, because though Prop 63 may increase, our needs and caring for people will increase. As we build more houses, and we've built subacute units, we've built houses, we've done all kinds of things. I'm on the Mental Health Services Act Committee in Contra Costa County. What happens is the number of people that need services is not decreased. It has not decreased since 2008. Our emergency rooms went from 550 a month to over 900 a month. If you think that you are going to cause homelessness to go away, this probably will not. More people are going to continually need services for this bill.
Could I ask you, as I had done earlier, if you could conclude? If you have any comments on the amendments, we're happy to hear them. We've already debated the bill.
The comments on the amendments are that there are not processes at the county levels except for in Contra Costa, and I brought it to the Mental Health Services Oversight and Accountability. We have a program and fiscal review that we do in our county on each of the Mental Health Services Act's bill. We are the only county that I know of that has an exact program that looks at everything like that. You have to make sure that this is in place before we go giving billions of dollars of MHSA money away for a very important program. But I think you're taking money from a program that desperately needs its funds. Thank you.
We appreciate your comments. Thank you.
Thank you, Mr. Chairman. Cliff Berg, here on behalf of the Jewish Public Affairs Committee for our member agencies, Jewish Family Services of Los Angeles and the Bay Area. We had hoped the amendments would include a simple statement that it's not intended by the legislature to have the result of cutting into existing mental health services. While the intent language at the end sort of implies that for debt service, we would like that language tweaked to be a little broader. That was not included, but we're very concerned about existing mental health services not being cut in some future down year, and would greatly appreciate your consideration of inserting that before we're done.
Thank you, Mr. Berg.
Mr. Chair and members, Andrew Langley on behalf of the County of Marin, and Riverside. Marin is in opposition, and Riverside is opposed unless amended.
Thank you, sir.
Thank you. Mr. Chairman, Rusty Felix, California Council of Community Behavioral Health Agencies. We have had a couple of amendments we have sought. We are not opposed to the bill. We think it would be better if you added the sentence that Mr. Berg raised about protecting existing services, which in a down year could be vulnerable, and also to address the one-size-fits-all issue. We understand that if you were to pick one program, the permanent supportive housing is the best one, but recognizing that counties may have evidence-based programs that are different, and again, depending upon the economy, we'll be able to get to those. There may be a need, perhaps now, perhaps down the road, for some amendments to deal with some of the types of programs that Senator Nguyen and others addressed that may not fit this model, and we may not be able to fund, depending upon the economy, with other funds. Thank you.
Thank you, Mr. Felix.
Hello, Anna Hasselblad with the Steinberg Institute. We are proud sponsors of AB 1618. I would like to note that previous investments of Mental Health Service Act funds for permanent supportive housing were leveraged, excuse me, an average of 4-to-1 to make sure that services and supports are available and that projects are sustainable, and that counties can access increased funds for services of all kinds, including mental health. Recent amendments to AB 1618 ensure oversight and accountability of the housing program, and the Department of Healthcare Services, as well as the counties, have a clear role in reporting accurate data to the legislature and to the public. Additionally, it established measures to ensure compliance with the reporting of county-level data and program outcomes. AB 1618 is the result of robust stakeholder process and reflects the input of experts in the field of bond finance, permanent supportive housing, counties and mental health and behavioral health services, among others. We thank these stakeholders, and especially the Senate President Pro Tem De Leon and Senator Leno, along with their staff, for their leadership on this issue. Thank you.
Thank you. We do have a motion by Senator Roth, so if there are no other comments from the committee, we call the roll, please.
AB 1618, the motion is to pass. Leno?
Aye.
Leno, aye. Nielsen? No. Nielsen, no. Allen? Aye. Allen, aye. Anderson? No. Anderson, no. Bell? Aye. Bell, aye. Block? Aye. Block, aye. Glaser? Aye. Glaser, aye. Hancock? Hancock, aye. Mitchell? Aye. Mitchell, aye. Monning? Monning, aye. Morlock? Morlock, aye. Wynn? Wynn, aye. Pan? Aye. Pan, aye. Pavley? Aye. Pavley, aye. Roth? Aye. Roth, aye. Stone? No. Stone, no. Wolk? It's 13-3.
Thank you. Measure passes 13-3. One last item before us. Thank you. We do have a motion by Senator Morlock, AB 1622. This is a Budget Act Junior, has some appropriation in it. Ms. Costa.
Thank you, Mr. Chair. As you noted, AB 1622 is a budget bill junior. It has 3 appropriations within it. It's for 2016-17. The first appropriation is $10 million from the Veterans Housing and Homeless Prevention Bond Act to the Department of Housing and Community Development. These funds would be used for loans to counties or nonprofit organizations for the construction and rehabilitation of transitional housing or shelter facilities specifically for veterans. This would be a pilot program to work with this population appropriation to better marry both services and facilities. The second appropriation, the 16-17 Budget Act already appropriated $45 million one time for the California Emergency Solutions Grant Program. This bill would provide of that amount $10 million one time to fund new pilots for this program in the counties of Orange, Fresno, San Bernardino, and El Dorado. And the last appropriation is $500,000 to the Department of Healthcare Services from the Mental Health Services Fund to support the activities we just discussed in the previous bill, 1618.
Thank you, Ms. Costa. We do have a motion by Senator Morlock. We have a question from Senator Roth.
With respect to the Prop 41 item, how does this differ from the process that's set out in Prop 41? And what's the genesis of the proposal? I'm obviously in favor of it, but I'm trying to understand, given what Prop 41 does, rolls out money, and I see we have an appropriation for $75 million, and this is going to take $10 million off of that. What does it do and why?
So the current Prop 41 program is really also targeting permanent supportive housing as well. While transitional housing is not a prohibited use of the funds, we've never really targeted those types of facilities in any meaningful way to where we can marry the services that could go for that kind of interim step before moving someone into a more permanent setting. So what we're going to do is modify the existing program guidelines and try to target some more construction of these transitional housings or shelter facilities while we continue to work on building longer-term permanent supportive housing for the veterans population. And while we are taking $10 million from the existing appropriation for that purpose, there is language in the budget that allows us, just to the extent we do get proposals for the existing permanent supportive housing program above what would be left, which would be $65 million in this case, it gives us the authority to make sure that we can still fully award any eligible project that comes in.
And the criteria that are used are the same criteria that are used to award the Prop 41?
No, so there will be some differences as we try to make sure that we get the right services provided for the transitional facility. So there will be some new criteria that will need to be developed, but we will be piggybacking for the most part or in large part on the existing program guidelines with some minor adjustments for this more targeted use. And it's kind of like advertising, marketing for a very specific purpose, something we really haven't done.
You know, one of the issues, of course, is it's Prop 41 money, so it's limited to brick and mortar facilities, and this does nothing to fund the services that we're promising people when they move into these facilities, transitional or permanent. It's a shame that we couldn't have addressed some of that in here over and above the Prop 41.
It does allow for capitalized operating expenses, though, so that is a big help for those smaller types of facilities for transitional housing. So,
is there some reporting? I mean, will we get a report back periodically on the success, since this is a pilot, on the success or not so?
We did not include that in here, but we'd be happy to report back to you.
Okay, fine, perfect. Thank you, Mr. Chair.
Thank you, Senator. Thank you, Mr. Howard. Senator Pan.
Just wanted to follow up on, I appreciate the funding for the homeless youth and exploitation program. I noticed mentioned 4 additional counties. What existing counties, their previous counties?
Mr. Murphy.
Thank you for remembering my name yet again, Mr. Chair. It is, off the top of my head, I'm going to actually have a hard time with this one. I know it's LA, San Diego. I believe it's LA, San Diego, and the Bay Area. Although I can be happy to get back to you with the exact one.
Back to me, I'd appreciate it. Thank you.
You had mentioned San Diego and which other? And San Francisco? Okay. Is LA County in there? Yes. All right. Thank you. Good question. Senator Nguyen.
Just a quick comment. I just want to thank you for the administration for this budget item. It's extremely important. I've had a family member who left military and went homeless, and none of us knew for quite a while, and just always saw him in the truck with his bed, and never knew that it's actually my brother. And then finally realized, oh my God, you're homeless, and you would never told us. And so I'm glad that we're trying everything we can to catch every one of these individuals who is helping and fighting for our country, and always sacrificing their family as well. So thank you.
Thank you, Senator Nguyen. Mr. Murphy, the only county that you had left out was Santa Clara, so otherwise LA, San Diego, San Francisco, Santa Clara. Thank you. Thank you. We have a motion. We have public comment? Please.
Good afternoon. As a constituent, stakeholder, and a shareholder in the state of California, I'd like to bring to your attention the appalling, scandalous schemes of what's happening with homelessness. Regardless if it's a veteran or a family that has been kicked out on the street because they can't afford their rent due to the fact that they no longer can pay their mortgage. This has been an outstanding problem, a crisis. It doesn't involve just people with disabilities. It involves non-disabled persons such as yourselves. So my reaction to all this is it's shameful, very shameful. I come from Los Angeles in a small town called Boyle Heights, and I observed the extreme tragedy of what the city of Los Angeles has done in violation of the Ralph M. Brown Act, discouraging us from public speaking to be involved in a committee known as the Homelessness Committee by a gentleman, elected official by the name of Jose Huizar. Mr. Dawson, Mr. Price, Mitch Englander.
Are you going to get to the bill before us? I have to ask you to do so.
So now, regarding this bill, the expenditure of it, will it really impact what this committee is bringing before us? It's a charming idea, as I put it, but the result is more damage to the cause. Show me sometime in this issue when you as a body will really take action for auditing, finding place and value, and having a table that really measures how this $10 million of budget appropriations will actually impact the homeless population of veterans, their families, and the population of people today on our streets. So, in so many words, this has become my public notice to all of you. Armando Herman, a resident, a constituent of the state of California, Title II discrimination, 54950 Brown Act violations, and our civil rights by the state of California to protect us from becoming more homeless. Please take this bill before Governor Brown and say to him, an actual constituent came from Los Angeles today and spoke on homelessness. Thank you for your attention.
Thank you, Mr. Herman.
Again, Kim Lewis with the California Coalition for Youth, and we want to express our appreciation and support for the augmentation of $10 million for the Homeless Youth and Exploitation Program. It's been a big priority for the coalition, as you know, the state in this fund exactly already funds it only at $1.1 million for the 4 existing counties, and it is adequately underfunded, and really appreciate this one-time augmentation and hope we can continue to do more to support our youth who can transition out of homelessness and live supportive lives going forward. Thank you.
Thank you. Madam Secretary, seeing no other comment from the committee, please call the roll on AB 1622.
AB 1622, the motion is to pass. Leno?
Aye.
Leno, aye. Nielsen? Nielsen, no. Allen? Allen, aye. Anderson? Anderson, aye. Bell? Bell? Oh, sorry. Block? Block, aye. Glaser? Glaser, aye. Hancock? Hancock, aye. Mitchell? Mitchell, aye. Monning? Monning, aye. Morlock? Morlock, aye. Wynn? Wynn, aye. Pan? Pan, aye. Pavley? Pavley, aye. Roth? Roth, aye. Stone? Stone, aye. Woke?
Nielsen, I don't know. Or no, aye.
15. Okay. Nielsen, no, aye. That's 15. Passes. 51.
We'd already closed the roll, sorry. Okay. So that measure is out 15-0, and without any other business before us, we thank Ms. Costa.
Thank you, Mr.
Sorry? We had not kept the roll open on anything. I'm sorry. Sorry. We stand adjourned.